Hey guys, I apologise for sitting here in my bra, but I just wanted to show where my surgical incisions are. I've been out of hospital now since yesterday. I had the op on Wednesday. It's now Saturday, so that's 3 days ago. Is that right? Yes, 3 days ago. It's been hard keeping track of time while I've been in the hospital. It's a little bit weird because I haven't had my normal routine. So I'll just show you where the incisions are because I'm a bit battered and bruised. So here we are. I've got 6 incisions, and these 3 here across the middle are about 1 inch or so long. I had a look when the nurse changed my dressing yesterday. These 2 down here are about 1/2 inch long. This one here was a bit of a problem apparently, and it's very bruised around the wound. And initially when I came up from the surgery, it had like leaked a lot of blood and like that clear stuff. I think that's white blood cells, I'm not sure. But it had leaked a lot, so there was like a big gauze patch over it as well. And then the 6th incision is in my cleavage, so I won't show you that. Let me just put this on pause. So yay, I have my top on now. So I just wanted to show as well my bruising where I have to pick up the phone for this, hold on. This is the bruising where my cannula went in. I do bruise really easily. You can see the red and brown bruising extends down. That's where the length of the needle was. Luckily I had my cannula out on the 2nd day as they did my bloods and it was all okay, so I didn't have to have it in too long. And then on my other arm I've just got loads and loads of bruises from where they were taking my blood pressure all the time, and where it was pinching my skin. I've got loads on my upper arms. In fact, it's really kind of sounds really weird to say, but in some senses having my blood pressure taken so often was almost the most painful part. It was certainly the most annoying part because when I came out of surgery my blood pressure was really quite high, and they were taking it every 15 minutes. So I was just hooked up to the machine with the cuff around my arm, and it was just inflating every 15 minutes. So it just kept kind of jolting me out of my drug-hazed sleep and waking me up. And then the first night it had to come down a bit after I'd been out of surgery for about 4 or 5 hours. It had come down a little bit, but they were still worried about it, so they set me on every hour to have my BP taken. So all through the night, just as I was kind of dropping off to sleep, the BP cuff would inflate again. I'd be like, oh God. And it would just wake me up, and then I'd be awake again, and it was incredibly noisy on the ward because there was 5 of us on the ward altogether, and the other lady who went down to surgery just after me was on a similar 1 hour BP thing, and so I would hear hers inflating across the room, and then I think, oh Jesus, mine's going to go off in a minute, and then mine would go off. So the first night I managed to listen to 4.5 hours of the BBC radio adaptation of of Neil Gaiman and Terry Pratchett's Good Omens, the whole 4.5 hours of that, which I'd downloaded as a free Audible book before going into hospital. Good tip there, make a new Audible account and you will get a book free. And then for the rest of the night I got I had like a relaxation hypnosis kind of meditation track that I downloaded from Google Play, which is Glenn Harrold's hypnosis MP3s. They are actually really good, but I listened to the whole thing, all 45 minutes of it, and was still awake at the end, and then I listened to it again and was still awake at the end. It was just so noisy and I was so uncomfortable because I had the oxygen. I was on just the nasal thing rather than the mask by that time, but I still had the oxygen in. I had the BP cuff tethering me on one side, and then I had the cannula in my left side. So, and I do tend to move around a lot at night. So I felt awful. But the second night was much better. 3 of the other guys had gone home by then, so it was just me and the other lady who had it done on Wednesday, and she was in a lot of pain. I actually feel quite lucky